Nkechi, come close. Call me that your short girlfriend and the husband too. I have a medical advice for you guys today. So today, I want us to talk about mode of delivery, and I want us to focus on cesarean section. Of course, we should know by now that there are two modes of delivery, which is the giving birth the natural way or giving birth through surgery. And giving birth the natural way is called spontaneous vertex delivery or spontaneous vaginal delivery, while giving birth by surgery is called cesarean section. So today, I want you to know that before a qualified doctor will advise you, that is a pregnant woman, to undergo cesarean section or to give birth through surgery, that the person has already ruled out every possibility of you giving birth by spontaneous vaginal delivery. And also, I want you to know that giving birth by surgery doesn't make you a weak person. It doesn't make the baby a weak baby. It's just a way of trying to make sure that you and your baby are safe in the end, because the aim of this whole thing is for safe child and safe motherhood. So now, I want you to know that there are several reasons that might prompt your qualified doctor to suggest that you give birth through cesarean section. Some of these reasons could be maternal. It could be related to you. It could be related to the baby. It could be related to the placenta. So it could also be related to the labor. So now let's take that of the maternal first. For maternal, for your doctor to maybe suggest that you give birth through cesarean section, that means one of these must have occurred. One is that maybe you have had previous cesarean section, at least 2 or more, or you have a classical scan. Another reason why this might happen is if you have a medical condition that doesn't support vaginal delivery, such as preeclampsia, or you have a heart disease. Another reason is if you have what is called cephalopelvic disproportion, and this one has to do with people that are short. That's why I told you to call your short friend, because scientifically it has been proven that short people tend to have what is called cephalopelvic disproportion, even though it is not limited to them. So these are the maternal reasons why cesarean section might be considered. Now, the fetal reasons, like the reasons that are related to your child. If a child is in fetal distress, you need emergency cesarean section so that you can sustain the child. When we mean fetal distress, we are talking of when the child is no longer breathing well, when the womb is no longer a safe zone for the child. So you have to bring the child out as soon as possible so that the child doesn't die. Now, the next thing that is coming from the child that can lead to this is maybe when you have the twin gestation, when there is a twin in the womb, and the first one is not presenting cephalic, the first one is not presenting with the head, so you might consider cesarean section. Another one is when the child is not presenting in the normal way it should present. For example, when there is a transverse line, or when there is abnormal presentation like breech presentation, when the child is presenting with the buttocks instead of with the head. Another one is when you have a big baby. For example, in the case of macrosomia, especially when it has to do with a diabetic mother. So when you have such baby are too big to come out through the vagina, it will cause you so many pain and injury. So any baby that is equal to or greater than 4 kg, it is not advisable that such a baby will be delivered vaginally. So you go through cesarean section. Now, for the placenta, there are some reasons that can make your doctor suggest that you give birth through CS. And some of them include when you have what is called placenta previa. This placenta previa means that instead of the placenta to be implanted at the upper side of your abdomen, it is implanted at the lower side. And you know what that means? What it means is that if you try to give birth vaginally, that the placenta will come out first before the baby. And if this happens, the baby will die immediately, because the placenta is what supplies the baby, what keeps the baby alive. It is the connection between the baby and the mother. It supplies both nutrients, blood, and whatever. So if the placenta comes out first, that means everything the baby is getting from the mother is cut off, and the baby will die. So when you have placenta previa, that is why your doctor would suggest that you give birth through cesarean section. Now, another one is what is called abruptio placenta. Abruptio placenta in a live fetus, like your baby is still alive, but you have abruptio placenta. And what is abruptio placenta? It means the placenta had a tear, like it came out from where it's supposed to be. You get, like, there is now bleeding where the placenta implanted, it came out from that place, and you know what that means. There will be severe bleeding. So if the baby is still alive, cesarean section will be indicated. Now, I want you to know that as much as your doctor is going to suggest that you give birth through cesarean section, it is not by force. Of course, you can actually decide that maybe you are not giving birth through cesarean section and nothing will happen. You get, but the repercussion that might come with it might be very, very delicate, both for the mother and for the baby. And some of these repercussions include that, one, you as a pregnant woman might run the risk of rupturing your uterus. And you know what that means when you rupture your uterus? It means you might even run a risk of hysterectomy. That's total yanking off of your uterus. And what it means is that you might not get pregnant again. So which one is preferable? To deliver your baby alive, but through cesarean section, and you alive too, saving even your uterus, or to give you your spontaneous vaginal delivery, why the baby might even be dead, why you might suffer lacerations, and then your uterus is being yanked off. Another thing is that the baby itself might suffer asphyxia if you continue and insist that the child should be delivered through spontaneous vertex delivery. The baby will suffer asphyxia, and this asphyxia might affect the brain in a very terrible way, leading to what is called cerebral palsy, a severe brain damage. Now, I want you to know that cesarean section doesn't reduce anything. It is just a means to make sure that you and your baby are okay in the end, because no woman should die while giving life. So it is a doctor's way of supporting you, because we love mothers. Mothers are the gateway to the world. You guys are amazing set of people. So we cannot just watch you die without assisting you. So cesarean section is a good thing, and we advise both the father and the mother to listen to this. And the next time that you have a sibling, a wife, a parent that wants to give birth through cesarean section, I want you to support them. I want you to advise them to accept, because so many people don't, due to maybe cultural belief. Maybe you have been told that your mom and your forefathers or your great grandparents did not give birth through cesarean section, that they gave birth like Hebrew women. Yes, I want you to know that giving birth through cesarean section doesn't make you less of a Hebrew woman. You're also a Hebrew woman. In fact, you are an angel for you to go through that pain and give birth and survive. You're a warrior, and we doff our heart for you. We are grateful for your sacrifices to humanity. So this video is just encouraging you that if your qualified doctor ever tells you to deliver through cesarean section, that it is for your own good and for the good of your baby, so that you will be alive in the end with less pain. Because when cesarean section is indicated, it means that the risk of giving birth through vaginal delivery is higher than the risk of cesarean section, because nobody enjoys cesarean section. Your doctor is not enjoying it. You get, it's just an alternative to make sure that you are safe and you are sound. So with this, Nkechi, I'll leave you and your short friend. So please make up your mind that the next time either the both of you or anyone around you gets pregnant and the doctor is suggesting cesarean section, they should sign consent, because the earlier they accept, the better for everybody. The earlier they accept, now if they accept early before labor, what it means is that there will be what is called a planned way instead of emergency. Now let me tell you, if you have had two previous scar, that's cesarean section or a classical scar, you must give birth, must underline, through cesarean section to avoid uterine rupture and some other complications that comes with it. Now, if your baby is in distress, it is a strong indication for cesarean section, so that the baby does not die when you are insisting that the baby must be delivered through spontaneous vertex delivery. So this and many more we will continue to talk about, even as we support our mothers and we encourage them to work hand in hand with a qualified doctor to have a safe motherhood. Thank you so much for listening. See you on the next one. I still remain your favorite, the Healing Inc. Catch you later.
Just what's it?